think a good example would be the study that's funded by the Doris Duke Foundation, which is subject to my Clinical Scientist Development Award. This is a study that looks at individuals with chromosome changes that affect a particular gene, which is ChRNA7 on chromosome 15. ChRNA7 encodes for a nicotinic acetylcholine receptor gene. And as part of the Doris Duke funded study, we examine patients who lack one copy of the ChRNA7 gene, and we investigate their clinical and behavioral phenotypes. So we do very in-depth phenotyping with the help of psychologists to find out what their behavioral profiles look like. It becomes evident that almost all of the individuals who lack one copy of ChRNA7 are challenged in their cognitive and intellectual abilities. On top of it, about 30 to 40% of all of these individuals meet criteria for autism spectrum disorder. And a good number of them also have a history of epilepsy. But on top of it, they have fairly complex behavioral phenotypes, including depression, oppositional defiant disorder, and even aggressive behaviors. Now, what's particularly interesting about this project is the fact that there are medications out there, some of them already FDA approved, some of them in advanced phases of clinical trials, that aim at particularly this protein in order to increase its function. So they nicotinic agonist drugs. They have been developed to help with smoking cessation or because of the gene's relationship with Alzheimer's disease and Parkinson's disease. But we hope that we can repurpose these drugs and use them in individuals who lack a copy of the gene, boost the activity of the remaining receptor in order to alleviate some of their symptoms. Well, it's certainly interesting that most of the individuals with schizophrenia have a history of smoking. And some of them say that smoking helps them to function better, to be better able to concentrate, and so on. The ChRNA7 gene itself has been linked to schizophrenia, and I see in several of the adults that I've studied that they do have schizophrenic phenotypes as adults. Now, clearly, the ChRNA7 gene is not responsible for all cases of schizophrenia, but that's part of what we're investigating, that if you give an agonist drug that boosts the activity and in some ways mimics the function of nicotine, whether that would help them.